Okay, so I recorded this fundamentals review for you guys. I've actually got two. So I'll include, I think that this probably is the one that you don't have a copy of, but you can go ahead and, make a copy yourself. But the next one is the one that I gave you in class. And please don't solely rely on these recordings or these reviews. Make sure you do these in addition to looking in your book and reviewing notes and such like that. Okay, so fundamentals, HESI review. Always want to think about the nursing process, even when you're answering these questions. This slide is very self-explanatory, so go through the steps of the nursing process and make sure that you understand what that's about. And I believe that you guys absolutely do. These are, the ethics and the legal chapter. Some of the definitions that you do need to know are like autonomy. Autonomy refers to the freedom from external control. The patient has the right to accept, refuse, or even terminate care, and that would be autonomous. Beneficence, to act in the best interest of others. And remember, non-maleficence is to do no harm. Justice is being fair, equitable, and appropriate treatment. Resources are equally distributed to all is what justice means. Fidelity, keeping commitments and promises to our patients, unwillingness to abandon patients regardless of the circumstances. Advocacy refers to the support of the patient. The nurse's primary commitment is to that patient or the individual, the family, the group, or the community. Responsibility, that obligates a person to accomplish a task. With delegation, you're responsible for both your own actions and the action of those to whom you delegate those tasks to. If orders are inappropriate, the nurse should question and clarify the orders. The nurse is responsible, though, for knowing pharmacological principles, drug interactions, and proper dosages. Accountability is accepting the ownership for results or the lack of results. You're accountable for the nursing actions you take. Confidentiality, to maintain the privacy of the client, non-disclosure of data or personal information. And remember, the person performing the procedure is required to obtain the informed consent. Assault, you guys will remember, communicating a threat or battery, intentional touching without consent or lawful justification. Slander occurs when one speaks falsely about another, and then libel is the written defamation of character. Negligence is conduct that falls below the generally accepted standard of care of a responsibly prudent person. And then also malpractice is essentially that professional negligence. Using silence gives patients an opportunity to collect and organize their thoughts. Silence actually will prompt some people to talk. So silence is not a bad thing. Especially therapeutic, it is especially therapeutic during times of sadness or grief, okay, when we're providing that presence. Hearing impaired, you want to make sure that you face the patient, you reduce the environmental noise, speak at normal volume. Don't assume a patient who is nodding yes understands. You want to confirm that understanding. Visual impairment. Identify yourself when you enter the room or leave the room, and make sure there is adequate lighting for those patients. Cognitive impairment. Use simple sentences. Okay, and avoid long explanations of different things. Patients with a stroke, ask simple yes/no questions. Use communication aids, like picture boards. You can use gestures. Let the patient know if you don't understand. Allow time for understanding and response. Patients who are unresponsive, make sure that you communicate both verbally and by touch and explain all the procedures and provide orientation when we're taking care of these patients. Overview of communication. Factual would be chart, objective, the information that we can gather using our 5 senses. It is either a measurement or an observation. Example, blood pressure, lab values, assessment. Avoid vague terms such as appears, seems, or apparently. Describe behavior, don't interpret. For example, do not chart patient combative, rather patient attempting to hit and bite the nurse. The only subjective data that you are to include in the record is what the patient says, and make sure you use quotation marks whenever possible. Accurate, the use of exact measurements. Don't chart urinated adequate amount, for instance. Chart actual amount of output. This establishes accuracy and helps you determine if a patient's condition has changed in a positive or negative way. It's essential to avoid the use of unnecessary words and irrelevant detail. Use correct spelling and proper use of abbreviations. Make sure you check your facility policy for that. Complete, they should be complete, these records, and that means contains appropriate and essential information. You frequently use flow sheets or graphic records to document routine activities such as daily hygiene care, vital signs, and pain assessments. Current, timely entries are essential in a patient's ongoing care. Delays in documentation lead to unsafe patient care. Most health care agencies use military time. Sexuality in older adults, they have the risk of STIs because risk of pregnancy is not an issue, so they think it's okay. Often do not recognize the need for protective sex because of this. Pathological issues with the aging sexual response are often related to illnesses and side effects from medications. Older adults often reluctant to discuss sexual problems with a healthcare provider. Faith, that provides confidence in something for which there is no proof. Hope, present when a person has something to live for or look forward to. Religion is that system of organized beliefs and worship. And this slide is very self-explanatory. Make sure that you go to these pages that are listed here and then review those boxes and tables. Okay, so airborne precautions spread through the air, like with tuberculosis. Make sure that we provide a private room with negative air pressure, and the nurse wears N95 respirator, which is a fit tested N95. And the patient wears surgical mask if they're required to leave the room. And remember, droplet precautions requires the wearing of a surgical mask when within 3 feet of the patient. Influenza is a droplet spread infection. Patient wears surgical masks for transport if they are on droplet precautions. Contact precautions require gloves and gown for infection that is spread by direct or indirect contact, like MRSA and VRE. Standard precautions apply to contact with blood, body fluid, non-intact skin, and mucous membranes from all patients. Okay, just a few things about sterile. A sterile object remains sterile only when touched by another sterile object. Only sterile objects may be placed on a sterile field. A sterile object or field out of the range of vision or an object held below a person's waist is contaminated. A sterile object or field becomes contaminated by prolonged exposure to air. When a sterile surface comes in contact with wet, contaminated surface, the sterile object or field becomes contaminated by capillary action. Fluid flows in the direction of gravity. The edges of a sterile field or container are considered to be contaminated on that 1-inch border. Just some reviews of your vital signs. You also have a chapter in this book that refers to vital signs, but you learn these as well in health assessment. The temperature obtained varies depending on the site used, but it is usually between 36 Celsius, which is 96.8 degrees Fahrenheit, and 38 degrees Celsius, which is 100.4 degrees Fahrenheit. Rectal temperatures are usually 0.5 degrees Celsius or 0.9 degrees Fahrenheit higher than oral temperatures. Older adults have a slightly lower body temperature. Nursing interventions for fever monitor vital signs, intake and output, and skin color and temperature. Monitor white blood cell count, hematocrit, or other lab indicators of dehydration or infection. Remove extra blanket when client feels warm, but provide warmth when chilled. Provide adequate nutrition and fluids. Adequate fluids would be between 2,500 to 3,000 mLs daily to meet increased metabolic demands from the fever and prevent dehydration. Administer antipyretic medication as prescribed. Limit physical activity to prevent heat production. Tepid bath to increase heat loss by conduction. Provide safety measures if patient is disoriented from fever. Okay, remember RACE is the rescue, remove the clients from danger. A is activate the fire alarm. C is contain the fire. And E is extinguish if possible. We're talking about restraints. We need to use them as a last resort after trying alternatives. You do need a physician's order, and do not attach those restraints to movable parts of the bed. And we remove the restraints every 2 hours to allow for exercise, toileting, and to check condition of the skin and circulation. Skincare, avoid too frequent bathing and use of hot water, moisturizers, clean skin regularly and at time of soiling. Avoid friction and lubricate dry lips. Common factors that interfere with sleep are heavy meals just prior to bedtime, caffeine, nicotine, and other stimulants, environmental factors such as light, noise, television. Major risk factors for obstructive sleep apnea are obesity and hypertension. Symptoms are snoring and excessive daytime sleepiness. Priority assessment is the respiratory system assessment. Health promotion to improve sleep would be environmental factors, mattress that provides support, room temperature, minimal noise, dark room, night light for infants and older adults. Promoting bedtime routines, avoid excessive stimulation just before bedtime, associate bedroom for sex sleep only, consistent time for sleep and awakening. Establishing periods of rest and sleep, stay physically active during the day, so more likely to sleep at night. Stress reduction, if unable to sleep in 15 to 30 minutes, get out of bed, do some reading, relaxation activity, rather than staying in bed and thinking about sleep. Bedtime snacks should include dairy product, warm milk that contains L-tryptophan is often helpful. No caffeine or alcohol before bed. It can also cause awakening during the night. It can act as a diuretic. NG tube, to check the placement by X-ray. Measurement of pH when you insert can give an indication, but you should always, before you use an NG tube, make sure that you have verified placement by X-ray. Some complications with NG tubes would be infection, catheter, sepsis, with TPN. Complications could include infection, catheter, sepsis. Change the TPN infusion tubing and TPN bag every 24 hours. Lipids, no more than 12 hours. So what else can happen with TPN? Electrolyte imbalances, hyperglycemia, monitor blood glucose every 6 hours. Insulin may be required. Fluid overload, sudden discontinuation can cause hypoglycemia. So you're going to want to infuse these patients with 10% dextrose when you're discontinuing suddenly. Urinary retention is, what we do for urinary retention is we assess for distended bladder. We're going to assess for signs and symptoms of lower UTI, which would be burning or pain with urination, dysuria, urgency, frequency, and foul-smelling cloudy urine. The first symptom of a UTI in the elderly may be confusion. Patient education for a healthy bladder: drink 6 to 8 glasses of water per day. Avoid beverages that contain caffeine or alcohol. Avoid drinking fluids 2 hours before bedtime, and void at regular intervals every 3 to 4 hours. Preventing UTIs include perineal hygiene, void at regular intervals, voiding after intercourse, not using excessive soap or taking bubble baths, wearing cotton underwear, and drinking acidic fluids such as cranberry juice. Urinary incontinence on a patient may cause reddened, irritated skin on the perineum. Transient incontinency, remember, is caused by a medical condition that may be reversible, like acute confusion or a urinary tract infection or even a fecal impaction. Functional incontinence, cognitive, sensory, or mobility issues, not a problem with the urinary tract. Something that can help these patients are time voiding every 2 to 3 hours for cognitively and mobility impaired adults. Stress incontinence is caused by coughing or laughing or lifting heavy objects. An intervention for stress incontinence would be pelvic muscle exercises. The Kegel exercises you can find on page 1118, box 46-8. Urge incontinence, urgency leaks on the way to the bathroom. Interventions would be avoid bladder irritants, caffeine, alcohol, bladder training, increasing intervals between voiding. Reflex incontinence related to spinal cord damage, not aware of bladder filling and the urge to void. Intervention, often intermittent catheterization is done. Concerning bowel elimination, factors influencing bowel elimination: age, diet, fluid intake, remember, needs to be between 2,000, 3,000 milliliters a day. Physical activity, psychological factors can cause variations in bowel elimination. Personal habits, position during defecation, pain, pregnancy, surgery, and anesthesia. Like anesthesia, they may have a paralytic ileus, and that may last 24 to 48 hours after, especially abdominal surgery. And some medications we know affect bowel elimination as well. Constipation is having less than 3 bowel movements per week. Causes could be improper diet, reduced fluid intake, lack of exercise, and certain medications can cause constipation. You can refer to page 1152, box 47-1. What are signs of dehydration? Would be dry skin, dark colored urine, less frequent urine than usual, thirst, decreased skin turgor, tinting, fatigue, and dizziness. One of the most important habits to teach regarding bowel habits is taking time for defecation. Advise the patient to begin establishing a routine during a time when defecation is most likely to occur, usually an hour after a meal. When patients are restricted to bed or need help to ambulate, offer a bedpan or help them reach the bathroom in a timely manner. It's important to provide privacy. Always place the call bell and toilet tissue within the patient's reach. When patients are at risk for falls, stand near them or leave the door partially open so that you can see them at all times. And assist patients who have difficulty sitting because of muscular weakness and mobility problems. Place an elevated seat on the toilet when patients are unable to lower themselves to a sitting position because of a joint or muscle wasting disease. These seats require patients to use less effort to sit and stand. And we talked about digital removal. That should be done as a last resort in the management of severe constipation and is practiced when all other methods have failed. The procedure is very uncomfortable for the patient. Excessive rectal manipulation causes irritation to the mucosa, bleeding, and stimulation of the vagus nerve, which results in a reflex slowing of the heart rate. Because of the potential complications of the procedure, a healthcare provider's order is necessary to remove a fecal impaction. Ostomy bags need to be emptied when they are 1/3 to 1/2 full. The pouch is changed every 3 to 7 days. Cleanse the peristomal skin with soap and warm water. Soap can irritate the skin. Assess the stoma color. It should be pink or red. Observe the skin for any signs of irritation or skin breakdown at each pouch change. Patients with colostomies have no diet restrictions. Patients with ileostomies will digest their food completely, but will lose both fluid and salt through their stoma and will need to be sure to replace these to avoid dehydration. Hypoventilation is characterized by a decreased respiratory rate or effort. As ventilation decreases, the body retains carbon dioxide. Signs and symptoms of hypoventilation include mental status changes, dysrhythmias, and potential cardiac arrest. If untreated, the patient's status rapidly declines, leading to convulsions, unconsciousness, and death. Causes are secondary to central nervous system depressant drugs that slow down the respiratory system, neuromuscular diseases that cause weakening of muscles that control breathing, or broken ribs. Hyperventilation is caused by severe anxiety, infection, drugs, or acid-base imbalance. Signs and symptoms of hyperventilation include rapid respirations, sighing breaths, numbness and tingling of hands and feet, lightheadedness, and loss of consciousness. Hypoxia is inadequate amount of oxygen transported to the tissues. Normal equals greater than or equal to 95%. Causes are diseases such as anemia, carbon monoxide toxicity, pulmonary edema, heart failure, pneumonia, drugs such as anesthetics. In the early stages of hypoxia, the patient is often anxious and restless. They're unable to lie flat. The patient's vital signs might also vary from baseline, with the heart rate, respiratory rate, and blood pressure elevated. Late signs of hypoxia are confusion and cyanosis. Where do you assess for cyanosis from hypoxemia? The lips, mucous membranes, tongue, and conjunctiva. Nursing interventions to promote oxygenation are positioning in that high Fowler's position, cough, deep breathing, chest physiotherapy, percussion, vibration, and postural drainage. Oropharyngeal suctioning is a clean procedure. Others use sterile technique. When suctioning a tracheostomy, the patient should be hyperoxygenated first. When suctioning, you apply negative pressure, 120 to 150 millimeters of mercury, during the withdrawal of the character, never on insertion. Never on insertion. Rotating the catheter enhances removal of secretions that have adhered to the sides of the ET tube. The entire procedure from catheter passage to its removal is done quickly, lasting no longer than 10 seconds. Acute pain may have physiological symptoms like tachycardia, increased blood pressure, fear, anxiety. Chronic pain, often not a definite cause, can result in depression, fatigue, hopelessness, affects the quality of life. Medications that can be used for pain medication other than opioids are NSAIDs, tricyclic antidepressants, anticonvulsants, and muscle relaxants. Non-pharmacological methods are the TENS unit, heat and cold therapy, distraction, relaxation, biofeedback, massage, and acupuncture. Crutch walking and gaits used. 4-point gait gives stability to the patient, but requires weight bearing on both legs. The right crutch, then the left foot, left crutch, then the right foot. Use a 3-point gait for non-weight bearing status on one leg. The affected leg does not touch the ground during the early phase of the 3-point gait. Crutches and bad leg advance together, then the good leg. 2-point gait requires at least partial weight bearing on each foot. The patient moves the crutch at the same time as the opposing leg to the crutch. Movements are similar to arm motion during normal walking. Individuals with paraplegia who wear weight supporting braces on their legs frequently use the swing through gait. With weight placed on the supported legs, the patient places the crutches on one side in front and then swings to or through them while they support his or her weight. Stairs with crutches, remember, up with the good leg and down with the bad leg. These 6 factors contribute to pressure ulcer formation. Patients with altered sensory perception for pain and pressure are at risk because they cannot feel their body systems. body sensations. Patients who are unable to independently change position are at risk because they cannot change or shift off of bony prominences. Patients who are confused may feel pressure but aren't always able to understand how to relieve it or communicate their discomfort. Shear force is the sliding or moving of skin and subcutaneous tissue while the underlying muscle and bone are stationary. Shear can be avoided by keeping the head of the patient bed at a lower angle. Friction is when two forces rub together. Example, a restless patient continuously rubbing his feet across the sheets appears as an abrasion or a sheet burn. Prolonged moisture softens the skin, making it more susceptible to damage. Problem with urinary or fecal incontinence. Dehiscence is the partial or total separation of wound layers. Obese patients have a higher risk of wound dehiscence. It can occur in abdominal wounds after coughing or vomiting. We need to teach splinting with a pillow when getting out of bed and coughing. Evisceration is the protrusion of visceral organs through the wound opening. Evisceration, remember, is an emergency. Immediately place sterile gauze soaked in sterile saline over the site, contact the surgical team, do not allow the patient anything by mouth, and observe for signs and symptoms of shock, as well as prepare the patient for emergency surgery. Nutrition. Patients need vitamin A and C, calories, and proteins to heal. They need 30 to 35 kilocalories per kilogram per day for normal wound healing. Protein needs are especially important for patients with wounds because collagen is a protein found in the dermal layer of the skin. How do you assess if this is adequate? With serum albumin and prealbumin are labs used for nutritional assessment. What do you do if a coworker has an emergency and asks you to administer medication she has prepared? You don't do it. A patient has a right to refuse a medication regardless of the consequences. What do you do if a patient refuses a medication? You want to determine the reason. You want to educate them, and document it, and notify the physician. Can you ever give a patient a placebo? You may not unless it's through a research study and they have been advised. Oral medications. Break-only scored tablets, crush-only medications approved for crushing or chewing, not the enteric-coated CR, SR, XR. Skin applications. Apply gloves, remove prior applications, rotate application areas to prevent skin irritation, apply clean, dry, intact, hairless skin, like the arm, the chest, or the upper back. Remember, with eardrops, adults, you pull the auricle up and back. With children under 3, we pour that auricle down and back. With eye drops, you ask the patient to look up, pull down the lower lid, administer to center of conjunctival sac, apply pressure to inner canthus to avoid systemic absorption of medication. With eye ointment, apply from that inner canthus to the outer canthus. And with rectal application, we want to make sure our patients are in the Sims position, which is that left lateral. Apply water-soluble lubricant. Adult, we insert approximately 4 inches. With the child or the infant, we insert approximately 2 inches. Intradermal injections do not aspirate. Inject at 10 to 15 degree angle with the bevel up and observe for wheal formation. 0.1 ml is the maximum volume. 3/8 inch needle at 25 to 27 gauge. IM injections do not aspirate when administering vaccinations. Aspirate other IM injections. IM sites recommended for greater than 2 mLs is ventrogluteal and vastus lateralis. Site for vaccinations or immunizations is the deltoid. Syringe and needle sizes for insulin, 1 ml maximum volume, 3/8 inch, 29 gauge, and you inject at a 45 to 90 degree angle. The deltoid, 5/8 inch or 1 inch, 23 to 25 gauge. Other IM sites can use 1.5 inch, inject at 90 degree angle. Complications of IV therapy include circulatory overload, infiltration, and phlebitis. Fluid volume deficit, sudden weight loss, postural hypotension, poor skin turgor, and dark yellow urine. Fluid volume excess, sudden weight gain, dependent edema, full neck veins, and crackles in the lungs.